Conservative House Democrats who oppose the health care bill, the so-called Blue Dog Democrats, met with President Obama at the White House today. Later, I talked one-on-one with the president, and I asked him if they'd made any progress working out their differences.
My working principle has been, number one, let's make sure that this package provides more choices to the American people, gives them more security if they've got a pre-existing condition or they lose their job or they're changing jobs. It's got to be deficit neutral. It can't add to our deficits. And it's got to bring long-term costs down. And I think rightly, a number of these so-called blue dog Democrats, more conservative Democrats, were concerned that not enough had been done on reducing costs. It's the same concern that I shared, and I think that we're moving in a direction where, at the end of the day, by the time we have a bill on the floor, we will be able to say unequivocally that this is going to bend the cost curve so that healthcare inflation is reduced. That's going to be good for American families. That's going to reduce their costs and make the system work better for everybody.
But it's not going to add to the deficit.
It will not add to the deficit. I will not sign a bill that adds to the deficit, period.
You've said that if Congress doesn't have a deadline, things don't get done in this town. But Democrats like Kent Conrad are also saying, quote, sometimes when you move too quickly, you make mistakes. So is this really something you want to dig in your heels on? I mean, is there any flexibility on this August deadline?
Well, I want to keep the pressure on because we're making steady progress. People are working hard. I just met with these House Democrats, and they were in there for 3 hours. I could only join them for an hour. I understand that the Senate Finance Committee is meeting 3 times today. That kind of work is going to produce good results. Here's what I won't do. I will, as I said before, I won't sign a bill that I think does not reduce costs, does not keep deficit neutral, and does not benefit middle-class families in America. So I want to put the pressure on, but ultimately the test is this a bill that I think is going to be better for the American people or not? And if it's not, then we'll keep at it.
So if it's not, you'll have some flexibility on this deadline.
If I'm not happy with the end product, I will not sign a bill.
Are you concerned at all that if health care reform fails, it will be a huge and devastating setback to your presidency and may put some of the rest of your agenda in peril?
You know, I think that the easiest way to keep your poll numbers up and to garner good press is to do not that much here in this town and not to cause a lot of controversy. And there are some people who would probably advise that that's the approach you should take. But that's not why the American people sent me here. They sent me here to solve problems.
Do you think any illegal immigrant should be eligible for health care under the new plan?
No. The one exception that I will think has to be discussed is how are we treating children? Partly because if you've got children who may be here illegally but are still in playgrounds and at schools and potentially are passing on illnesses and communicable diseases aren't getting vaccinated. That's, I think, a situation where you may have to make an exception.
Mr. President, if the stimulus plan isn't really working, at least for now, why should Americans sign off on spending billions of dollars on health care reform?
I disagree that the stimulus plan is not working. Think about where we've been, and since that time, we have stabilized the financial markets. We have created the ability of businesses to borrow again. We have prevented thousands of layoffs in states all across the country. Are we where we need to be? Absolutely not. Would things be much worse if we had not put the recovery package in place? Absolutely.
Later outside, I asked the president about the current unemployment rate, which is at 9.5%. Your administration projected that with the stimulus package, as you know, unemployment could be kept under 8%.
Yeah.
Well, that was then.
Yeah, we blew through that pretty quickly, and I think that, in fairness to my economists, nobody, when we were first sworn in, anticipated that in the first 3 months we would lose 700,000 jobs per month. So I think the severity and the depth of the recession was something that really exceeded everybody's expectations.
Vice President Biden said you had, in fact, misread the economy.
Well, that's what he was referring to.
Right, but who's to say you're reading the tea leaves accurately now?
Meaning what?
In the future, when you make these projections and estimates and cost savings, I mean, it's a pretty dicey proposition, don't you think, to predict economics into the future?
If what you're saying is that economists are often wrong, you're absolutely right about that. And but that can't be a rationale for inaction.